Hey everyone, welcome to Taking the Pulse, a healthcare and life sciences video podcast. I am Heather Hoops Matthews, joined today by two Maynard Nexsen healthcare attorneys. Here in the studio with me, Matthew Roberts. Matthew, good to be with you.
Good to see you.
And in Alabama, Lauren DeMoss. Lauren, hello.
Hi, Heather. Good to see you as well.
You too. Today, we are going to go through a lightning round of issues that we think are going to come up in 2024. So get your pens ready and let's get started. We're going to start with hospital at home programs. What are you guys thinking about that?
You know, Heather, one thing I'll say in terms of thinking about 2024 and what that looks like, and it's always kind of fun to predict, I think, what's to come. And we'll see if this podcast ages well or not, in terms of kind of what we're thinking might be the hot topics. And I think some of them are for sure. But, one of them is hospital at home, which is not anything that's particularly new. But it certainly has gained some momentum. I think in the stat is, as of late August 2023, CMS had authorized 296 hospitals and 125 health systems in 37 states to offer hospital at home. With obviously this gaining momentum out of the pandemic, I think for 2024, to me, the issue is, are they around to stay? Are they going to continue growing? Will there be some sort of new waivers kind of put in place from the government? And what will those look like? I think there are some that have probably operated very successfully. Others that maybe depending on the state are learning still what that looks like. But I think a question there really in my mind is are they here to stay, or do they kind of morph into something different? Matthew, you may agree or disagree.
Oh, I definitely think they're growing in terms of the use, and I think they're probably here to stay in some shape or form because, as we know, if you're sick, a hospital is not always the best place to be. Home could be better. And I think the hospital recognizes that, hospitals recognize that, CMS recognizes it. So I think what's interesting that with hospital at home, CMS got ahead of the states in some respects in offering this up in terms of paying for it, but there are all types of hospital license and regulation that didn't really allow for it. So the states are catching up. But I do think we'll continue to see it. And I think the results from the patients have been relatively good because they're treated as an inpatient in the hospital, but they're recovering at home with the support they need based on their condition.
Yeah, that's interesting. This year already, we're both all hearing a lot about the upcoming election, right? And that's only going to get louder and louder as we go into 2024. What are some proposals that you both see possibly coming out of the election?
I'll say just generally, Heather, I think that election year always makes it interesting in terms of healthcare policy. And, what the point of emphasis is. It sounds like to me, some of the early debates and the candidates, the health insurance and how that looks, what that looks like from Medicare, if it looks like a universal health insurance. And I think that's always a topic of big discussion. But to me, in my mind, with the election coming, it's interesting to see what policies we hear kind of push forward. We obviously have, certain things being pushed forward by the potential candidates, but then once we're looking at the two primary candidates, what their policies are and what that might shape, including fraud and abuse, kind of Medicare as a payer, a universal payer. Those are kind of the big issues in my mind that we'll watch and see how it unfolds.
It's always interesting, as Lauren indicated, about what comes out as people test ideas for purposes of political campaigns. But as our politics become more populist, I think you're going to see things where they want more deregulation. And we're seeing that at the state level. South Carolina repealed CON last year. They're going to try to do some additional deregulation in healthcare this upcoming session. I think other states in the South will try that as well. But I think you'll see things like we want a way to lower costs. So I think there'll be more bills that will address maybe the insurance's protection and antitrust. We know last year or 2022, the Inflation Reduction Act was addressing the cost of pharmaceutical goods. And I think you'll see more of that as we get closer to the election. Now, whether they get passed, that's another issue.
Sure.
But I think you'll see a lot of populist type concepts.
You just mentioned CON, and since we started this video podcast, that topic has come up a lot in multiple states. But what about state regulation of other kind of healthcare deals?
Well, that's happening as well. Lauren, I don't know if you want to lead off with what you're seeing in the states you work in.
Yeah, I mean, I think Heather, that's a good segue because obviously licensing agencies, CON, licensure in various states have in some way regulated, quote, regulated healthcare deals, in terms of what that looks like from changes of ownership and when you can transfer a certificate of need or license. But what we're seeing is I think it's now close to 10. It's Colorado, Connecticut, Massachusetts, New York, California, Illinois, Minnesota, to name a few of them, are enacting these kind of mini Hart-Scott-Rodino acts for healthcare deals, where there's some sort of prior notice to the state in some capacity. It could be the same agency that governs licensure and or CON in the state, or it could be notice to the state attorney general. But these are kind of a layer of filings on top of what you think of as your typical kind of healthcare deal filings. But these are pre-merger kind of notifications that the states are starting to ask for. And as you see kind of, private equity and other merger and acquisitions within the industry, the enactment of these little mini HSR acts will be interesting to see whether it slows deals down, whether it keeps deals from going through. So it will certainly have an impact on some of the deal activity.
I totally agree. Part of this is in response to the consolidation in the healthcare industry and the insurance industry, frankly, where hospitals are gobbling up other hospitals and bigger hospital systems. Now you've got private equity buying up physician practices and other types of healthcare providers. I think state regulators are concerned that if these players get so big, it will be difficult to deal with them, and maybe you'll have access issues. So even in states that aren't necessarily blue states, these concepts are being discussed, which is a little bit ironic from a political standpoint. But I think we'll see more of these as we see more healthcare consolidation occur.
When we were all together this fall at the North Carolina Life Sciences Organization meeting, we talked about AI in healthcare. Lauren, what are your thoughts next year for AI?
For us, I think AI is nothing incredibly new, but folks' use of it in the industry, or desire to develop, or certainly it's an area where we are getting a ton of questions as it relates to HIPAA and cybersecurity concerns. When you have someone trying to kind of build out an AI database, and they want more and more information, and that information happens to be protected health information. Dealing with those issues, there is not anything within the HIPAA framework right now that kind of explicitly governs how that looks in the industry. And so I think there are some states that are beginning to enact laws that address kind of the use of AI. And I say the use of AI, it's kind of the gathering of information, or the, aggregating of information, and then also providers wanting to use AI for their own efficiencies, clinical efficiencies in terms of documentation, or just looking at utilization management trends. So there's kind of twofold use, wanting to gather data from an AI perspective, and then using, AI to kind of enhance efficiencies within a practice. And I think hopefully we'll see maybe some guidance that helps us learn how to govern those issues. But we're certainly seeing more and more questions about, kind of surrounding AI and how to address, I think in my mind, the, tons of issues that come into play when you're talking about AI.
I think AI is going to be the issue. AI and its related doctrines are going to be the biggest issue that affects healthcare in the next 10 years, because it's going to affect everything from the gathering of information to the processing of information to the diagnosis and treatment of clinical diseases, how its use in clinical research. And the legal infrastructure is not prepared for this. There are not regulations or laws that, as Lauren alluded to, that address it. And, Biden had his proposal on AI just as an executive position, but there's a lot coming down the pipeline in terms of statutory regulation. And I agree with Lauren on the state level, because the federal government may not be able to do something quickly enough because of the politics, and I think you're going to see some states address it. But it's a big issue, lots of potential upside, as we've heard with guests on the podcast recently, but lots of scary question marks about who's governing it and what controls are there on it. And I think it's going to be with us for a long time, and I think we're going to be talking about AI in healthcare for a long time.
I was going to say, and in terms of grappling with and understanding, you have things at the state level, but even you think about the FDA and, use of AI and how AI might enhance, some sort of device that's governed by the FDA, depending on where it kind of is classified. And as it uses AI to kind of improve or enhance, I think agencies like the FDA, this comes into play because they're kind of grappling with how do we approve something fast enough if they, AI is being used to make changes to it. And, they've actually, issued kind of proposed guidance in terms of, when folks wouldn't have to go back to the FDA for any sort of approval if they've used AI to kind of enhance a medical device. So I think that I make that point to kind of emphasize there's just so many issues kind of surrounding the healthcare industry and use of AI or development of AI that come into play here.
And to bring in another issue, which we've been talking a lot about, is cybersecurity. So if you've got a heavy AI use for technology or whatever, and it gets hacked, then what are the implications then, both clinically and then legally? So I think that we're just beginning to see the tip of the iceberg with AI, and a lot of it's already been happening. I mean, a lot of companies have been using AI to run algorithms and to manage data already. They don't talk about it, and now we're beginning to understand the implications of that a little bit more.
I have 1,000 questions, but we don't have time for that. Continued shift to value-based care. Where are we going to see? What are we going to see with that?
Well, this has been something we've talked about since the beginning of the podcast, and probably going back, I don't know, Lauren, 5, 6, 7 years. The math doesn't work on the volume-based care. We can't continue to pay providers to treat people based on episodic treatment at the rate we're doing now. That Medicare or Medicaid will run out of money. So this concept, I think everybody agrees we need to shift something that's away from the more you get paid, the more you do, the more you get paid, to how well you do it and how economical you do it, and how your quality is. The problem is it's hard to change the tires on the car while it's driving down the highway, and that's what's going to have to happen. We are seeing a shift more toward that now. You see payers giving incentives to providers with upside based on hitting certain quality goals, so upside risk. And some bigger providers who are able to manage their data, they're looking at taking downside risk. So you get paid less if your scores are lower. We have to go there. It's just a matter of, will the people who are running the larger payers, which include CMS, and then large private insurance companies, will they lead that move, or will it be a provider-led move in an effort to get ahead of the game to get paid more or get paid in a different way?
Yeah, and I think too, you think about, Medicare's Innovation Center, the CMMI, that was created, I guess almost a decade ago now, and thinking about too, this ties in with the election, next year and what that looks like, and in particular, programs like the bundled payment program that are, pushed out through the end of 2024, at least for now, and how does that look, and are there, additional kind of initiatives similar to that begin, or is there kind of a lull as depending on what happens with the election and what that looks like and where the emphasis is, will you see more, to Matthew's point, at the Medicare payer level, and who's kind of driving it there? I think that'll be interesting to see with the value-based care.
Ironically, in the Southeast, I think you've seen some of the more interesting innovation in the Medicaid side, on the Medicaid managed care, with some of the incentives that have been put out, which is interesting. But the patient's role is not really well defined in value-based care, and their role in keeping themselves healthy and doing the right things and being compliant with physician orders. That's another piece that needs to be worked into it, no matter who the payer is. So that I think we're still in the horizon level where we're just seeing it out there, but it's coming sooner rather than later, hopefully.
every time I log into LinkedIn, I get asked, are you hiring? And I think, like, who isn't hiring, right? Everybody's hiring,
Right.
especially in the healthcare industry. You have these shortage of workers, nurses, et cetera. What do you see in 2024 there? I guess no relief.
I'm not seeing, Lauren, you see any relief? I mean, we have a shortage in almost every provider,
Mm-hmm.
and it's not as easy as just creating more medical schools or nursing programs. So I think people are trying, but I think it's going to hit us in the next 3 to 5 years on the physician side. As you see a lot of the physicians who are now working into their 60s, when they roll out to retirement, there's going to be a gap, and it's not going to be easy to fill short term.
Yeah, I think that's exactly right. I don't see any kind of I don't see these issues with shortages being alleviated anytime soon. And it could get worse, into 2024. Not for the operational folks, probably cringe when they think about it, but I think there might be. You think back to the podcast we did too with
The immigration lawyers?
yeah, foreign
Yeah.
medical graduates, and just the how cumbersome that process is. As you try to fill different roles in like health, shortage areas, what that looks like. I think that really, I don't see those issues being a non-issue for providers anytime soon.
I think what you're going to see that's related to this issue is an expansion of the scope of practice fights at the state level, where they try to give non-physicians more ability to do work independently. Not taking a position on that one way or the other. I just think it's coming because there are not enough physicians. So they're going to see nurse practitioners, other mid-level providers have, pushed to have an expanded scope of practice.
It makes me think about, after COVID, we all kind of got okay with there could be tables at a restaurant that are empty because they just don't have enough workers, and we understand
Sure.
that. And that's okay when you're eating dinner out, but I wonder what the public's going to think when they try to go get, services for their health, and
Right.
they can't in a timely fashion.
Well, and then that's going to bring up the issue of telehealth again, which the payers have sort of pulled back on a little bit because they're concerned about overutilization. But if you don't have enough providers in a location, then you have to link up to where they are, and telehealth is probably the best vehicle to do that.
Let's end on a topic with a punch. Fraud and abuse enforcement.
Bad topic to end on.
Yeah, but it's so interesting to me at times.
Well, I think COVID, one of the positive things about COVID is the federal healthcare infrastructure focused on fraud and abuse was redirected to focus on health and wellness for the country. Now they're refocused, and the government, it pushed out billions of dollars to providers. And now, as is often the case, what the government giveth, it taketh away. And so you see a ton of COVID-related fraud and abuse. You shouldn't have taken that money. You misused it. But you see some other things, too. We've got an increase in the number of fraud and abuse investigations involving Stark, anti-kickback, false claims cases. So the government's back in business, and the whistleblower community is back in business on this.
Yeah, and I think, too, in addition to the money pushed out with COVID, too, and we've seen it with COVID testing and labs and how they've maybe done various testing, investigations that revolve, around that particular issue. We've seen an increase of those as well. So I think, Matthew, to your point, maybe there was a little lull as folks tried to figure out how to navigate, COVID, the pandemic era. But I think with that feelings mostly behind us, almost completely behind us, I think they're ready to investigate again. Is what it feels like.
They are, and the frustrating thing, particularly for labs who were they were the point of the spear to try to diagnose and figure out who has it and who doesn't. They were doing what the government asked them to do, and they were responding to the challenge. And then the people were going to get tested. So to now go back and do audits in a huge way, it's sort of frustrating because they were reacting to a global pandemic. And it's now, second guessing them, I think is going to be tough to process. But I think we're going to have to expect some of that.
Right. And then the election could change everything. So we're just going to sit back and watch. But Lauren DeMoss in Birmingham, Alabama today, thank you so much. Matthew here with me, thank you. We won't score you next year this time, but we will revisit.
I'm thinking you might, so we'll just have to wait and see.
We will revisit and see what ends up in 2024. For those of you who joined us, let us know if you like this lightning round concept, and we'll bring it back. And those of us on the Pulse, we thank you for joining us and look forward to seeing you next time right here on Taking the Pulse, a healthcare and life sciences video podcast.